I'm Dr. Michael Pippin. I'm a board-certified gynecologist. We're going to talk about gynecologic cancer, which is a pretty broad topic, but we're going to limit ourselves to talking about uterine cancer. The main risk factors there are obesity and certain characteristics, including heredity. Uterine cancer has totally different risk factors than cervical cancer. It's mostly a disease of postmenopausal women, but not always. The biggest risk factor is obesity. We're not sure 100% why obesity is a risk factor, but it's thought that obese women make estrogen endogenously by their fat cells, and this high level of estrogen over a long period of time promotes the development of cancer inside the lining of the uterus. So obesity is the single biggest risk factor. We used to say that other risk factors were diabetes and hypertension and some other issues, but it turns out that obesity is the primary risk factor. The most important thing to be aware of is abnormal bleeding. So postmenopausal women who have bleeding for any reason, it's not normal, and that's an early sign of endometrial cancer, so they can certainly be aware of that. Premenopausal women who are obese or overweight and have irregular bleeding are also at risk, and so they may need to be screened as well or tested for the presence of precancerous conditions of the uterus. A diet low in fat and calorie restricted diet so that you don't gain weight. We all have a tendency to gain weight with aging, and the American diet and lack of exercise has caused more and more people to become obese, and this has made one big factor contributing to the increased risk of uterine cancer. So weight reduction and keeping and avoiding obesity is very important. Eating a low-fat diet is important. The other thing is for women to be aware and to come in right away for abnormal bleeding, especially bleeding after menopause is never a normal situation, and so they need to be tested, and they shouldn't wait to see if it goes away because it might be the only sign they get before they find out they really have an advanced cancer. So uterine cancer is always a surgical disease. It's hysterectomy and lymph node sampling for uterine cancer. The good news is most uterine cancer is diagnosed at an early stage and most often cured by surgery alone. There are advanced cases, of course, of uterine cancer, and beyond surgery, there is radiation therapy, chemotherapy, and some unique medical therapies for it as well. For women in general, they should be aware that getting regular screenings, and that includes both PAP and HPV testing for the appropriate age group, is important because that's the best way to prevent the development of cancer or diagnose a precancerous condition early on in its course. Plus the other benefits, general health benefits of getting screenings. For the older age group, being aware of their body, being attuned to their body, and not putting off symptoms that they know are not quite right. So regarding endometrial cancer, abnormal bleeding for people who are premenopausal, and for people who are postmenopausal, basically any kind of bleeding, even if it's just spotting, could be a sign of endometrial cancer.